One big sort of unwitting surprise that a lot of folks get into when they first jump into Medicare is the simple fact that coverage for original Medicare, that is just the most baseline ability for coverage under Medicare, is pretty limited. And it doesn't cover a variety of services that most noticeably, and especially when someone needs it, includes dental coverage. Now, this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does really help our channel grow, but also because it keeps you up to date on today's newest Medicare changes, today's best Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So let's talk about original Medicare and teeth, which is a weird thing to say, but I find myself saying it more and more every single day. But either way, in this case, when I'm talking about Medicare, I'm referring to just original Medicare, which is the two main parts of Medicare that are operated by the federal government. So that is Medicare Part A and Medicare Part B. These two parts of Medicare are what folks usually get right when they turn 65 years old. And very briefly, Medicare Part A covers things pertaining to hospital care. So that could be hospitalization, that could be big surgeries, that could be life-threatening operations. Things like that are usually covered under Medicare Part A. For almost everybody on Medicare Part A, there is no cost for the Part A because it is paid for, sort of prepaid, usually while somebody is still working and paying it through a payroll tax. So if someone has been working for a minimum of 10 years or 40 quarters and have paid into the payroll tax, and trust me, you would know it because you would see a noticeable difference on your pay stub every single month from how much you actually get paid versus how much you actually put in your pocket. But if you've paid all those taxes for all those years and meet those minimum criteria, then the Medicare Part A portion should not have a cost to it monthly. Now, the other half of what is known as original Medicare is Medicare Part B, and that covers things pertaining to your normal day-to-day care. So things like doctor's visits and specialist visits and lab work, x-rays, and physical therapy, all those kinds of things are covered under Medicare Part B. Medicare Part B, regardless of how many years somebody has paid into the payroll tax, is still going to have a monthly cost, which in 2024 is $174.70 a month. And that will usually come out of somebody's Social Security check if they're receiving it, or they can be billed directly for it. And also important to note is that it changes almost every single year. And by changes, I mean usually goes up. So both Medicare Part A and Part B, or what's called original Medicare, is great coverage. And it's a great program, probably one of the best programs the US has ever invented. I'll say it once, I'll say it 1,000 times. But one thing that is not really, it's a strong point, and there are a few, but one is the fact that it doesn't really cover any dental benefits. Now, if you also want to see some of the other things that are not covered by Medicare, check out our earlier video, 5 things not covered by Medicare. So in practice, this means that when folks turn 65 years old and enroll into Medicare and go to a dentist, Medicare will only cover very, very, very specific dental issues. There are not any specific dental procedures that are covered per se, but they are things that original Medicare will cover if they are dental related, but related to other things that are covered by Medicare. So an example of this would be an infected tooth removal prior to having an organ transplant, because having infected teeth during an organ transplant could make everything else go pretty bad. Or maybe if someone is going to be going through cancer treatment, but their teeth are infected or in bad shape, that could, again, overall affect the outcome of that cancer treatment. Oh, another one would be if somebody needs a surgery on their jaw. So maybe they got an accident, they need reconstructive surgery on their jaw. Those things, the things that are related to teeth, would be covered under Medicare in general. But if you need a crown, if you need a bridge, if you need an extraction, those things are not. The good news is, though, that there are quite a few dental options, and by quite a few I mean many options for Medicareans, that is, people who are on Medicare to get their teeth taken care of. So let's talk about a couple of those. So first, and one of the most common ways to get dental coverage when you are on Medicare is through a Medicare Advantage plan, or what's called an MAPD, or Medicare Part C, or Medicare Health Plan. Those are all the names for it, but it is the same exact thing. It has many names, but essentially what it is a health plan that is only accessible to folks who have Medicare, in fact, who have both Medicare Part A and Medicare Part B. So having Original Medicare gives you access to these types of Medicare plans that many times will have basic dental coverage included on them for no additional cost, and then can oftentimes have like kind of stepped up 1 or 2 or even 3 different levels better of dental options available for an additional cost within that plan. These add-on dental options through Medicare Advantage plans are both HMOs, which usually have less expense to them but can be more restrictive as far as which dentists you can use, or even PPO types of dental plans that can give the Medicare beneficiary a much larger range of dental options but usually have a more limited amount of coverage for the services that they use. Now, digging down a bit more into the dental care available on Medicare Advantage plans, at the basic level, most times just including Medicare Advantage enrollment will be basic dental services. That means that things that are covered by Medicare, that is Medicare covered dental services, which will not have a cost to them or would fall under the copay and coinsurance structure or even the caps that the Medicare Advantage plan has. In addition to that, those plans will usually cover additional non-Medicare covered dental services like routine oral exams a couple times a year, or what could be called basic cleanings or even x-rays, but that is about where those free services tend to end. At the time of enrollment during the standard annual election period, which is October 15th through December 7th, then that is when someone could opt into one of these HMO or PPO dental plans through their Medicare Advantage plans, if dental is available, of course. Usually the dental coverage is not covered by the same carrier that is doing the Medicare Advantage plan, but usually like a third-party dental-only plan that contracts with the Medicare Advantage plan to provide the dental services. There is almost always, not always, but almost always an additional cost for those improved dental benefits that can range anywhere from $20 a month up to $100 extra a month, depending on the type of dental coverage that the Medicare Advantage plan has available for them to choose. These plans will have either a copay or a set amount of money that has to be paid for each dental procedures, or perhaps a coinsurance, or even a max amount of money that the dental plan will pay on the Medicare beneficiary's behalf towards those particular services. So it can be a little bit confusing. So with regard to the very specifics of these dental plans with the exact numbers and the exact percentages and the dental networks, well, we're gonna save that all for another video. But the main point of this is that through Medicare Advantage plans, it is possible to get a more full traditional style dental coverage that someone would have had maybe through their work coverage before they turned 65, or a standalone dental plan, or a health exchange, or some sort of under 65-year-old plan. Those can be available on a above 65-year-old plan or a Medicare plan. In addition to plans that are available once someone enrolls into a Medicare Advantage plans, there are still standalone dental plans that will work with folks who are 65 years or older or are eligible for Medicare, just like the dental plans someone would have bought on their own, maybe prior to being 65 years old. They may have different fee structures, they may have different monthly costs, and they oftentimes do not require an enrollment period to enroll, so they can be enrolled in all year long, and they are still widely available with both HMOs and PPOs and sort of everything in between. But it's important to note that dental plans on the individual market, meaning outside of Medicare or outside of a carrier, are kind of the wild, wild west, and they can have a pretty large assortment of ways to cover somebody's dental needs, but really it may not be for the faint of heart. So if you have real dental issues, more than just maybe cleanings and a few things here and there, you're probably going to want to talk to a professional about which dental option is best for you if you're not getting it through your Medicare plan. And last, and I will not get too deep into this because once again, it really is going to be worth its own episode, is that for folks who are 65 years and older and who have sufficiently low income, which is actually not that low. I mean, here in California, a couple can still make up to $30,000 a year or around that amount and be eligible for a Medicaid, or what is called Medi-Cal, or even maybe even higher incomes under specific situations. But my point is that with this, for those folks who do qualify for Medicaid or Medi-Cal, there are an attached dental component called, obviously, Denti-Cal. Right? Getting a dental in California, Denti-Cal, portmanteau, that will pay for more dental than the normal Medicare up to a certain yearly limit. So that is another option as well, and we're going to delve much deeper into that in a future video. So overall, thinking about it, Medicare, again, great program, but it definitely has some holes in its coverage, specifically in this case, dental coverage. But it is good that there are still other options available for really anyone to get dental coverage through Medicare if they're eligible for Medicare, or even outside, even if they aren't eligible for Medicare. And that could be a Medicare supplement plan, that could be a Medicare Advantage plan, it can even be standalone dental plans, or even Medicaid or Medi-Cal, as it's called out here in California. So that being said, figuring out which is the best option for you can seem a bit overwhelming. Trust me, I know. So if you have any additional questions about Medicare dental benefits, or dental benefits for people who are on Medicare or perhaps even over, or really anything Medicare related, or just want to get some information about your specific situation, feel free to reach out to us at the information down below, or leave a comment, or check out our other great Medicare videos on the socials, on YouTube and on Instagram. So for Michael's Medicare, I am Michael, hoping that you have a great rest of your day, and goodbye.